So, vision and nutrition. What you eat can help or hurt you. And those are blueberries, in case no one knew. They're usually not that big. If they were, that would be even better. So a quick review, these are the muscles of the eye, and with the exercises the last time, which was a couple weeks ago, we actually talked about how to work on the strengthening of the muscles, but you also have to learn how to relax them so they can change the shape of the eyeball itself to help make sure that the focal point is actually where it needs to be. So if you're farsighted or nearsighted, it'll kind of adjust appropriately. So that is the reason that we're doing the exercises, and I'm going to go over just a couple of those real quick just to review. Now the part of the relaxation, really big part, is the belly breathing, and I like to show off the belly on this one. So remember, when you breathe in through the nose, the belly should go out and out through the mouth. This is how we breathe when we were little babies, because we just naturally knew how to do that, and that's why babies are so cute. You always want to poke them in the belly because their bellies are always going out like that. So it's in through the nose, out through the mouth. And that really helps to hyperoxygenate the blood, and that's always good for better vision. Now the palming, this is normally done seated, but I demonstrate like so. You have the heels of your hands on the cheekbones, the fingers crossed across the forehead like so, and you do the belly breathing, so it's in through the nose, out through the mouth, and you just focus on darkness. And this is going to really help to stimulate the rods in the eyes. Those are the ones that see low light and black and white, so in through the nose, out through the mouth. And that really helps to focus on the relaxation. And this next one is my absolute favorite. This is the one that I did one time and was able to get rid of my glasses for 2.5 years. Yep. So what this does is, as opposed to stimulating the rods that do the low-level black and white light, this stimulates the cones, which does the color. And so what I did, even though it's a little more advanced, I didn't realize at the time, and it was kind of funny watching me. I was actually standing outside of a Whole Foods, true story, and I look up at the sun, and it's like super bright. It was the middle of the day, and I did my hands like this, and that creates a strobe light effect that stimulates the cells and really helps to rejuvenate vision a lot. It was amazing. And then I found out, and I only did that for about 3 sets of 10 to 15 seconds each. And it was amazing. I mean, you see spots for a while because you're staring at the sun. They always say don't stare at the sun, you're going to burn your retinas. And Dr. Bates, that actually originally came up with this method, he and his students got taken to court saying they were going to burn people's retinas and things like that. And he had all kinds of clients, celebrity clients back in the 1900s that said, I'm fine, I don't have any burned retinas. And they did the studies and all the retinas were fine. So all those got dismissed. So a lot of times the people that are blazing a path through the frontier of new opportunities, new chances for a new way of thinking, they get criticized at first, and chiropractic was the same way. So now we're going to talk about 3 of the main conditions that people worry about. Glaucoma, that's an increase in the pressure of the eyeball itself. And when you have increased pressure in the eyeball, it actually starts to put pressure on that optic nerve. And this is going to cause permanent loss of vision, which is really bad, but we actually have foods that will help to relieve that pressure in the eyeball. So if you have any kind of glaucoma or know anyone with glaucoma, really important that you pay attention to that. And I'm also going to give you a downloadable list of all the foods, so it's going to show you what goes with what. So just in case you were wondering. This is another big one, age-related macular degeneration. Now, of course, they don't really know what causes this. It's the macula in the back of the eyeball, in the retina, that starts to deteriorate, and you can't focus, and you start to get blurry vision, especially if you're over age 60. I'm not looking at you, Gary. But it's one of those things that I'm looking over there. I'm not looking at you.
Because you're sitting in front of me.
Exactly. But it's one of those things where it's kind of like with arthritis. People just say, oh, well, that's part of old age. Well, no, that's not how it has to be. As patients here know, that if you do the proper nutrition, have the proper hydration, get the proper motion in those particular joints, and especially nutrition with the eyeballs, because there's not a joint involved technically, then you're actually going to heal that tissue, and it's going to constantly regenerate. And as you know, your blood is recycled every 120 days, so you have brand new blood cells in there. So in the skeleton, it's 12 to 18 months, you get a brand new skeleton. So if you make sure your bones are aligned properly, then you're not going to have as much arthritis, and eventually the body starts to resorb that. I always thought that was kind of neat. And this is also called ARMD. We're going to abbreviate it later, so So that's a mouthful. Age-related macular degeneration. Now, cataracts. Now, this is the most common thing over the age 40. It's another one that they're not exactly sure what causes it. It's in the lens of the eye itself. Now, you've got proteins in there, and sometimes it starts off in a really small area, and then it can grow, and that's when you see people, it's kind of has a cloudy look in their eye, and that's a really big cause of blindness, which is really, really bad, obviously. But it's another issue of if you have the proper nutrition, proper hydration, and the muscles of the eye aren't causing a lot of strain on the lens, it's going to help to reduce that. And if you already have cataracts, there's some other foods in here that will help to reduce that and help to clear up that lens, which is hard to believe, I know, but true. Working with the body. That's the secret. Now, everybody thinks carrots. Carrots are always great. So I always thought rabbits must be able to see really well because they eat carrots all day long. But what it is, it's the beta carotene in those carrots that, and there's a poster back there that you can actually see when you cut a carrot, a cross section, you can look at it and it looks almost like an eyeball. And what it is the beta carotene helps act as an antioxidant and actually helps with night vision as well as maintaining the health of the retina itself. So carrots, very good. Eggs. Yep. If you're juicing, that's fine. You don't have to eat it. Anytime you get the contents of the carrot into your system, that's good. Juicing, it'll be even more concentrated, so it's good. But it actually is a problem if you eat too many carrots. I've seen this in one case. If you eat carrots all day long, your skin starts to get an orangish tint. So cut back if you start to turn orange. The eggs are really great. They contain lutein, zeaxanthin, zinc, and vitamin D. And that helps to fight off the cataracts and the age-related macular degeneration. So right there, eggs is good. And they always talk about, especially in California, you need to have egg whites, don't eat the yolk because of the cholesterol and all that. So it's not true. The cholesterol, that's where all the good nutrients are. And that's where all these great ingredients and these great vitamins and minerals is in the egg yolk itself.
Does it matter if it's cooked or raw?
No, doesn't matter. Okay. I was like, who said that?
I did.
Oh. If you fry it, it's going to reduce the nutrients a little bit, but you don't want to eat it raw because sometimes they're not the healthiest, and you don't want to do a Rocky where you're chugging down a dozen raw eggs because it can be a little rough.
And juice them.
Oh yeah, you can put some in there. Yeah. Now the next one, this is the powerhouse. This is why it was the poster child for the nutrition for vision. Blueberries. Very high antioxidants and vitamin C. Now this is what you can do if you have pressure in the eyeball itself. Eat blueberries every day. Now and people always ask, well, how many blueberries? Do I have to eat like a bushel basket of blueberries? Like, no, you don't want to eat that many blueberries. The important thing with this is you can eat consistently blueberries every single day, even if it's just a handful every day. So throw that in your juice, throw it in your little smoothie in the morning. It's amazing. This is just, blueberries are delicious too. I do this every morning in my smoothie. Next one's good too. Fatty fish. This helps to prevent dry eye. And it has the omega-3 fatty... Do you have dry eye? See, more fatty fish. They have fatty fish in Canada?
Yeah, but you gotta wash the fish though.
Well, I know. Well, you don't want to get you definitely don't want farm-raised fish at all. It has to be wild if it's salmon. You can also do mackerel, anchovies. The smaller fish are really, really high in the DHA, which is really, really good. And that is going to be amazing. That also helps with brain function as well. The next one's really interesting too. It's another one for cataracts. Legumes. So lentils and things like that. It is amazing. And this is a really neat stat that I found, is that countries that have high diets in lentils significantly lower rates of cataracts. So in India, they eat a lot of lentils and a really significantly lower rate of cataracts. So make sure you eat more lentils. Got that, Alex? Okay, just check. You look confused. And this is the godsend of everybody here in the office. We always talk about coconuts, coconut milk, coconut water. The caprylic acid and the medium chain triglycerides, they act as a second source of energy for the brain. So you don't have to have the glucose all the time. You can actually use this. And it has been amazing results with Parkinson's patients and Alzheimer's patients that aren't quite processing the way they should. And you they did a study where they had Alzheimer's patients draw a clock before the treatment, and they would draw just kind of a couple of squiggles, and you could tell they didn't have a clue. They couldn't remember what a clock looked like. But then after only a week of, I think it was 3 to 6 tablespoons of coconut oil, they were able to draw a circle and numbers, and it was obviously a clock. So there were obviously some connections that were being made there after the medium chain triglycerides with the coconut milk was incorporated in. So, I mean, why not always be that way? You want to be on top of your game, have your brain firing on all cylinders, so to speak. So make sure you incorporate your coconut milk as well as coconut oil, coconut water. Coconut water is amazing because of the electrolytes. So if you're drinking a lot of water, because we always encourage you to drink at least half your body weight in ounces of water, then you might get your electrolytes a little diluted. So if you drink coconut water, that actually has the electrolytes in them, so you don't have to worry about diluting your electrolytes out.
But this is raw coconut, right? Not the stuff, they have the coconut.
You just get a young Thai coconut, crack it open. We have a great video on the YouTube channel how to open up a coconut. Yeah, you can't get that? I bet you could get it shipped.
By the time it gets there, it's not good.
The internet's amazing. I bet you could get it, even in Winnipeg. Yeah. Tomatoes. We always know tomatoes are really good because of the lycopene. Any bright colored vegetables and fruits are always good for you, because the bright color is always a healthy nutrient of some sort. It reduces the light damage of the retina. So especially here in Southern California, if you've been out in the sun a lot, you're getting your vitamin D, which is really good. It's been so hot lately that you might have a little retina damage just from being in the sun, because even if you have your eyes closed, that those ultraviolet rays are going to get through into the retina. So make sure you're eating your tomatoes, and it's also good for prostate health, lycopene is. So that's why you always find that in all the men's health formulas over in Centrum and all those different places. This next one's kind of neat too. Yes, ma'am.
I heard that tomatoes, in regards to prostate,
Yep.
were better if they were cooked
Really?
rather than raw.
I have not heard that, but that's good to know. So,
I did hear.
did you hear that as well?
Tomatoes cooked, the nutrients are more bioavailable
Okay.
for the body.
Okay.
And carrots. Those are the two.
So steam them or cook them however you like.
Yeah.
Very nice. Good to know. So cook your tomatoes and carrots. Pistachios. Another one with the zeaxanthin and lutein. What was the other one that had both of those? Eggs. Zeaxanthin and lutein. So that also fights the age-related macular degeneration. So losing your vision because you're getting older, get you an omelet with some pistachios in there and you'll be good. I'm just kidding. You don't want to eat that. That would be a little rough. Pistachios are good though. This one's kind of surprising. Dark chocolate. There you go. But we always knew that dark chocolate was good for you because it's got that increased level of the cacao in there, the cocoa, and that helps a lot with antioxidants, increases the blood flow. Also, spicy peppers are good for blood flow as well. And that's going to help to make sure you keep all those arteries going to the eye healthy and get the oxygen to the eye to make sure it doesn't start to break down. That's really important for the macular degeneration as well. And the next one, everybody's going to love this one too. I love this one. Tea and coffee. So it helps everything. Dry eyes, cataracts, macular degeneration. Maybe if you threw some blueberries in there, it would help with that intraocular pressure for the glaucoma. But this is really, really good. And I actually read that if you drink 3 cups of tea or coffee every day, no more than 3 is the magic number, that it actually helps your brain to stay less foggy. So it's going to help your vision, and it's also going to help your brain to function better. It's the caffeine. Yeah, the caffeine increases the circulation. So, and once I'm done with these, I actually have a neat little, if you were here last time, we're going to break out the string and practice the focusing. I'm going to tape it up to the wall over here, but that's going to be in just a minute. So these are the 10 foods that we've covered so far. Carrots, eggs. Carrots, don't forget, cook the carrots. Thank you very much. Blueberries, the superfood. Am I in the way? Fatty fish, but not the farm-raised salmon. You don't want farm salmon wild always. Legumes helps a lot with the cataracts, so lentils, things like that. Coconut is the miracle nut, even though it's not a nut. Tomatoes, cook those as well for the lycopene and sun damage. Pistachios, excellent. Just don't put them in the eggs. That's got the zeaxanthin and the lutein. The dark chocolate, which is delicious and filled with antioxidants, it's going to help with the circulation to the eyeball itself. And tea and coffee. So now this is going to go over each individual benefit. Carrots, retina health, and night vision. You can't technically see in the pitch dark, but it helps with night vision so you don't get that aura around lights and things like that. Eggs fights cataracts and macular degeneration. Armed. Blueberries help decrease the eye pressure, so that is good to help glaucoma. So if you do have increased eye pressure, I know somebody was here last week or last time that had increased intraocular pressure. I don't know if they're here today though. It wasn't you, was it? No. Yep. Blueberries. So if he's watching, blueberries. Fatty fish are good for dry eyes. The legumes are good for the cataracts and the macular degeneration as well. Coconut's good for brain function and just overall circulation and brain fog, and that's all going to help with vision as well. The tomatoes for the light damage of the retina. Pistachios for armed, fight the armed. Dark chocolate, that helps with low light vision and helps increase circulation, as I talked about before. And tea and coffee, that fights cataracts, armed, and dry eyes. Now this was only 10 of the foods. We can actually, if you want to download this list plus a few other foods, you can go to drjohndewitt.com/20foods, and that will give you a complete PDF thing that you can print out, and it'll have all the beneficial effects. That's the good thing about food. They're not side effects, they're beneficial effects of those particular foods. And this is actually a book that's available on Amazon right now. I tried to get copies for everybody today, but I couldn't get them shipped out soon enough. I apologize for that. Okay, so chiropractic-wise, there's a study that was done with an ophthalmologist and a chiropractor that talks about these arteries here. They go down, this is the neck obviously going this way, and so these are going to be threaded through these little holes. You have holes in the side here in the cervical spine, and so when you get a cervical adjustment, that takes the pressure off these arteries and increases the circulation to the brain, and that has actually been shown to help improve vision. So cervical adjustments, I know sometimes people get a little worried. They think, oh, I don't like the cracking in my neck, it hurts and that kind of stuff. It's actually not the bones cracking, it's just a carbon dioxide bubble forming in that synovial fluid of the joints, and they're called zygapophyseal joints. Don't worry about all that. But that pressure taken off, increasing that circulation, that's really important that you do that, because that's going to help your vision, among a million other things. Numbness, tingling in the arms. You know, I know we're not chasing symptoms, but we're trying to get you at optimal state, and that's going to really help immensely. That is also what the cervical curve is for, or the curve corrector I like to call it. I know I demonstrated this before. Everybody here has probably seen it a million times, but you just go like this. You can even do this with a towel at home or something like that. Just rest your arms like this. Chin goes up, chin goes down, and you can relax the pressure, and then just let your arms rest, just like that. And that helps, especially if you have a reverse curve in the neck. That's going to help heal the ligament back here, because this is how the head should be. If you have forward head carriage, the ligament that goes from here all the way down to here is going to be damaged, allowing that to go forward like that. But when you do that curve like that, that pumping action helps force fluid in here, and that's going to help heal that ligament, and that's going to get that head back over the shoulder. That's going to take the pressure off here. That's going to help better circulation to the brain, better vision, and you're not going to get nearly as many headaches or symptoms in the arms, upper extremity numbness, tingling, and things like that. So now I'm going to demonstrate how this works. This is to train we have binocular vision, so you have two eyes that go out like this, obviously, and they're more towards the front so that we can focus this way. They're not on the sides. You'll notice chameleons have eyes like on the sides of their heads, but they move independently so they can see all around. But with us, we're more focused this way. And so what you do, I'm going to stick this to the wall over here, and you can try this yourself. You're going to have it on the wall here. You put it right on the end of your nose, and it looks kind of funny, but you focus on the front bead, and that makes it look like there's a V going out, and then you focus on the second bead, and that makes it look like an X. I know this looks really silly right now, but when you do it, you're going to notice it's really kind of neat. And then you focus and you work your way down from each bead, kind of going back and forth, and that's going to show you where you can have some insufficiencies in your vision and some of the muscles you need to focus on strengthening or relaxing to help with that. So I'm going to stick this up here right now, and don't forget, if you want to download your list, it's right there. Also, I wanted to say, our cruise, we have a cruise, and everybody always makes fun of me because of my giant watch, but I got this on the cruise last year, and it was so much fun, really educational. We had over 16 hours of teaching with Dr. Bergman, and we had Dr. Porcella and some other people that did some really great instructional things while we were at sea. And this year we're actually going to the Western Caribbean. We're going to go to Haiti, Jamaica, I believe, Mexico, and there's one other one, I can't remember what it is. But That's going to be in February of next year, and the deposits are due next month. So you can go to owners-guide.com/cruise 2016, and you can, if you're on the Facebook page, you can get the link there as well. And if anybody wants to go, it's going to be lots and lots of fun.